Nominated Member of Parliament Honorable Sabina Chege, also the former women representative of Murang'a County, has brought up such an issue in Parliament today, an issue that has caught the attention of the whole Republic at large, where she has argued and also requested that because the government led by President William Ruto are all saying that SHA and SHIV is working, they should all now be able to use public hospitals. The government officials, because they are the ones that have made Kenyans to suffer under the SHA narrative and everything that has been going on all day. Since President William Ruto came into power, now it's about time that we don't leave the Kenyans only to suffer the burden of, because most of the Kenyans are unable to take care of their hospital bills. So, because you all are claiming that SHA is working, why don't we all, as government officials and public servants, all of us, be going to seek medical attention at public hospitals? This is why I'm saying this. Now, listen to this. Honorable Sabina Chege, the former Murang'a women representative, as of today, filed a motion before the floor of the House seeking all the public officers to use the public health services. This will be a very huge boost to the current government in terms of tax collection and the entire revenue process that can be used in developing various sectors. We all know that katika mambo yote ambayo yamekuwa yakiendelea, the private sector, the private hospitals are the ones that mostly our public servants huwa wanakwenda kule kuweza kupokea matibabu. Most of these people use millions of shillings in these private hospitals. If they should be going to seek this medical attention at public hospitals and they leave this money at public hospitals, then we can say that we will be pumping our revenue back into the system through public hospitals. And because you have all told us that SHIF and SHA are working, it's high time that we encourage our members of parliament, governors, senators, MCAs, and everybody that has been working in the government of the day and in support of this new healthcare system to now start using public hospitals, including the president and his family, the wife to the president, Mama Rachel Ruto, the children to the president. They shouldn't all be entitled to private treatment and private medication, private hospitals, because they have money and they have they have the government resources at their disposal. Why shouldn't they also use the hospitals that are used by the normal mwananchi? Now, Sabina Chege, who is the self-proclaimed Jubilee Party leader, has been much vocal and influential in the political space, bringing the Mount Kenya region to a standstill when she holds the government to account sometimes. The Speaker of the National Assembly, Honorable Moses Wetangula, will therefore read the motion to the members so that they can debate on the matter and come up with various amicable solutions and agreements on the motion. A country that is ruled by the rule of law, democracy, and transparency is likely to have more development and become prosperous in various sectors that benefit its citizens, either directly or indirectly. That's what Sabina Chege says. And I come in support of this, because we all had one Honorable Kimani Ichung'wah telling us it's high time that we have to accept the fact that SHA hasn't been working for everybody. It has been working for some, but not for everybody. So you as a member of parliament, you as a cabinet secretary, as a public as a principal secretary, you are entitled to the government amenities. So why don't we, as people who are currently working under the regime of President William Ruto, also go ahead to decide now it's high time that we, as the government, the whole government of the republic, tuanze kutumia nini? kutumia public services like hospitals, sisi tukue tukipokea matibabu kutokea katika hospitali za umma. Now, when I look at this motion that has been brought by Sabina Chege, I compare and contrast it with the country of Botswana right now, led by Captain Traore. Captain Traore has made it essential to the people of his country that you have as if you are working as a government official, you have to make sure that kama ni hospitali, if it's hospital you need medical attention, you have to go and receive hospital to receive medical treatment in public hospitals in his country. Now, he is not from Botswana, he is from Burkina Faso. Now, Traore was part of the group army officers that supported the January 2022 Burkina Faso coup d'etat and brought the patriotic movement for safeguard and restoration military junta to power. From March 2022, he has served as the head of an artillery regiment in Kaya. Now, when we look at what Ibrahim Traore, the leader of Burkina Faso, has achieved through this, the money has been pumped into the economy of Burkina Faso. You know, the government officials of Burkina Faso used to go to seek medical attention out of Burkina Faso. They used to go to India, Dubai. They used to go to London, UK. They used to go to the United States once they want to receive medical attention. But the people of the people who put them into power, the people who made them acquire those the money that they had so that they could travel outside the country to seek medical attention, were suffering because the healthcare system was violated. It was not good for anybody. Yet, you want us to use the same healthcare system. All Sabina Chege is saying is, Bwana President William Ruto, you have said that this system is good for everybody. You have said that the country needs to work. How about we do it in this manner? Kwa sababu sisi ndio ambao tulichaguliwa na tumewekwa katika viti ambavyo tumekalia kama wawakilishi wa wananchi wa taifa la Kenya. How about we decide that now it's about time we also decide now to use the public to seek, if somebody is sick, if a member of parliament is sick, let them seek medical attention, not because of the reach of their pocket. Wasiende kule Karen Hospital, wasiende Aga Khan. They shouldn't go to Nairobi West. They should be going to Kenyatta National Hospital. Same to you, Mr. President, any member of parliament, any governor, any senator. Yeah, we should all be channeling our money and we should be seeking the services, treatment services from our public hospitals. Yeah, with that, wananchi wataona we are all selling on the same boat and what we are selling to them is good for us also. Hatuwezi kuwa tunauza kitu ambacho sisi hatutumii. You can't be selling water to me while you're drinking wine. That's what Sabina Chege has said. And the motion is supposed to be read in Parliament, I bet, this week, before the end of the week. And now it will be discussed in Parliament, and now they will fight the way forward. And that must be put as a rule, as it is in Burkina Faso, the way Captain Ibrahim Traore has done. That kama unahitaji matibabu, huwezi kwenda kupokea matibabu kama wewe ni mfanyikazi wa serikali, utaenda kupokea matibabu katika serikali za kibinafsi, katika hospitali za kibinafsi. You will receive treatment from public hospitals because you are a public servant. Are we together? And you will pay. Utatumia pesa zako kulipa for healthcare services. For now, that's what's up. Make sure you subscribe to our YouTube channel for more news and more stories. See you in our next video.